to Community Connections with Children Services Council. I am but one of your hosts, Sean Boyle, and of course with me is
Ashley Mock.
And welcome to the half-hour radio and today TV show that's all about connecting you, the listeners and viewers, to what resources are available to children and families in St. Lucie County. Now, we've been doing this radio program for about 4 years.
We think.
And we've been doing a TV program thanks to a great partnership with WLX, the St. Lucie County Education Channel, to provide this radio program to you on video, on demand, and on YouTube and all their stations once a month. So we utilize, if you're a first-time listener or viewer, we utilize this time together to talk about what there are to do in St. Lucie County, things to do in a resource, so that you yourself may be able to use this resource, but perhaps if not yourself, those around you, whether they be a congregation member, a co-worker, or a neighbor, or just those that you love, can spread this information so that the people that need help and need the resources can get them.
And we understand that we share a lot of information, so we don't expect you, of course, to remember it all, but we do have several ways that we can get that information to you even after the show. You can connect with us on our website, which is cscslc.org. You can also find us on Facebook, where we share information about who the guest is going to be each week, all the information that they talked about, and from time to time, funny stories, funny little clips, and parenting tips. So Facebook is a great way to connect with us as well.
And they can also connect with us if they want to share a topic for us to speak about on our next show. They can text us at 772-237-1130. Yes, that is my personal text, and yes, I will get it and use that information for future shows.
We do respond to texts and Facebook messages and any other way that you want to connect with us, so we're very open. Sean always says this is your show, it's not just our show, so we welcome the conversation with all of our listeners.
You're certainly welcome to come host it with us as well. Now, school has started.
It has. It was a long week, I would imagine, for most parents,
now,
myself included.
I have a 10th grader, so I've been through this many times before. It doesn't make it any less stressful or traumatic at times, but you started school with your children for the first time.
I did. I have a kindergartner this year, which not just a big difference for us, but for her as well. But we had a great first week. She was super excited. She came home the first day and said her favorite thing was lunch. So I guess that's pretty.
It's a good lunch. It's a good lunch.
She's very excited to be going through the line and choosing her own lunch. So that was a big bonus for her.
Now you told me if we can share this, and if not, you told me she said something that most students, maybe don't say, but she was excited to learn.
The night before school started, I said, "What are you most looking forward to? What is the thing you're the most excited about?" And she said, "Learning."
That is outstanding.
I think she should be a poster child for school. Yeah,
and she's going to a great school system.
She is. We're very excited. I think we got very lucky with the school she's at, the teacher she has. So we're really looking forward to it this year.
So let's move on to some of the tips that we generally give, and this is a good transition. School has started. It's I had to get up very early this morning to go to jury duty, and I'm here now, but. Very early, and it's dark outside.
Yes.
And there are little ones, whether the little ones be 16, 17, 18, or 5, 6, or 7, they are out going to bus stops, they are out walking, and sometimes it's not always light outside. So please, 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 we said this on the last radio program, please be extra careful when driving through neighborhoods and bus stop areas to make sure that no tragedy happens with our kids.
And I'll just say, too, great partners, the Roundtable of St. Lucie County, the Sheriff's Office, the School District, Public Schools Facebook page, all shared a video that the Sheriff's Department has put together that talks about how to drive through school zones, safety around buses that have been stopped, talks about the laws, talks about the penalties if you break those laws. It's a really great way to stay informed about what you can and cannot do, and kind of a reminder that it's extra it's time to be extra cautious around those school zones.
Slower than normal, put the phone away, stay focused, and keep our community safe.
Definitely.
So another tip that we want to give is, because school started, and this has been a tip that we've been giving out lately, but it's important, is if your child is not enrolled in an after-school program, school gets out at 2, 3, 4 o'clock, depending on the age of your child, and most parents get home around 5, 6, or 7. On occupied time, your children are going to find something to do. Let's make sure that it stays positive. I know it's positive anyway, but let's make sure it stays positive. Enroll them in an after-school program. We have we fund, the Children's Services Council fund 12 after-school programs in 16 locations in St. Lucie County. But even if you don't choose one of our programs, make sure your child gets enrolled into an after-school program so that they can get their homework done. I know you're just going through this, but when they get older, there's nothing better than getting home from work and hearing, I have my homework done.
Yeah.
Because otherwise, you're adding on a couple hours or an hour to your time.
Yes.
And they'll get involved in the community and pro-social involvement. So make sure that your children are enrolled in an after-school program.
And if you don't have one yet and you're still looking, as I mentioned, our website is a great place to find them. But if you download our mobile app, which you can find for free in both the Apple and the Android stores, you can actually map where our after-school programs are. So if you're looking for a place that might be close to work, a place that might be close to home, you can identify where all of those locations are right from your mobile phone. Super easy.
Wow.
And we have the directory online.
Oh, yeah.
And our
Everything.
website.
We try to make it super simple for parents to get the information that they need.
And if you're like me, you like to see it live action. Ashley and I will come to your place of business, to your group, your civic group, your congregation, and come have a conversation, not only about the resources that are available to children and families in St. Lucie County, but kind of also the state of the child in St. Lucie County.
Which, you know,
We've done several times.
and some people are probably surprised when they hear the information that we have to share. So we'd be happy to do that for anyone who's listening.
So another tip that we want to give out before we get to our guest, who's waiting very patiently, both here and out in the hallway, is that we have a big event coming up on Saturday, September 5th. Now, if you're don't realize September 5th is the Saturday before Labor Day, so it's a
And
holiday
super
weekend.
close.
And very close, yes. And we are planning, that's why she said super close, we are planning our 9th annual Sundays in the Park event. It's going to be held at Tradition Stadium, and that's where the St. Lucie Mets play. I always say that so that people don't go to Tradition.
To Tradition.
From 10 a.m. to 1 p.m., we are giving away free ice cream to all those who attend, and all children will get a book. In addition, we will have vendors there to have fun games, arts, and crafts.
Lots of our funded programs will be there, setting up tables to share information about their programs. They'll have fun games to play. I spoke just yesterday, with Big Brothers Big Sisters, who has an awesome water play activity that they've done for the last couple of years. So it's really a great time, and we're really thankful that this year we've got some wonderful sponsors, Walmart and PNC, who have come on board with us to ensure that every child who attends gets to choose and take home a free book. And in addition to that, we've got some wonderful agencies that are coming out that day to share information. So we last year estimated about 1,400 were in attendance, and we're thinking that this year is going to well exceed that. So please make plans to come join us. It really is going to be a great time.
And I would say that if you're on Facebook, and I know you've already gone over and liked our page since we've been on the air, but look up Sundays in the Park and where you click on that you're going.
You join.
You join so you have an idea. But if you're interested in taking your kids, by all means come. But if you're interested in volunteering, because we're looking for volunteers,
Of course.
if you are into scooping ice cream or handing out books to kids or just greeting families as they come in, by all means connect with us, and because we're looking for volunteers.
We are always looking for volunteers. We will gladly take them for Sundays in the Park.
So we have one more tip. It's a tip that we typically give out nearly every week.
And very fitting for our guests today.
It's perfect. It's perfect. I want to talk about health insurance for your child. If you know of any family, whether it be your family, a neighbor, congregation member, coworker that does not have health insurance for their children, there's a program in the state of Florida called Kid Care or Healthy Kids. It has a couple of other names, but most people know it by Florida Kid Care or Healthy Kids. Please make sure that your child has health insurance by simply calling this number. It's 772-626-5616. That is a live person. Her name is Danny. Children's Services Council provides funding for her to be a liaison to work families through the Healthy Kids Kid Care application process, or even those families that are on Kid Care or Healthy Kids. If they run into issues, they can contact her to work them through it. The only qualification in order to get Healthy Kids Kid Care is that you currently do not have health insurance. Now, how much you pay will depend on how much you make. But I promise you that it's very competitive to the open market rate if you make over the subsidy amount. But if you're under that subsidy amount, you can get health insurance for $10, $20 a month for your children. And make sure your child has health insurance, because medical treatment by going to the emergency room is not the best way to instill a healthy growth and healthy learning in school and so on. I'll let my guests talk about that. Our guests talk about that.
I'm biting my tongue.
But by all means, if you need health insurance for your child or know somebody that does, write this number down. I'll go really slow this time, I promise. It's 772-626-5616.
And just as an added incentive to get Sundays in the Park on your calendar, Danny will be there that day. So it's a great time if you have questions, if you have concerns, you can pull her aside there at the event. She'll be there all day helping families get information about healthy kids.
So we have two great guests who already said they're waiting to get in, especially when we talk about health care for children. So would you like to introduce them?
I would love to. We have had a wonderful partnership with Florida Community Health Centers and have had several of their doctors, nurses, nurse practitioners on the show over the last couple of months. But we are really excited to have today with us Dr. Carrie Daniels and Molly Ferguson, who is the Director of Development. Did I get that right? Oh, okay. Close enough.
We got 20 more minutes. We can get that title in
I
right.
got a lot to talk about.
There we go.
So first, I know Sean talked about some of our funded programs and some of the things that we focus on, but one of the things that we have been doing with Florida Community Health Centers is the Adolescent Health Program for several years, I think, longer than I've been around.
And it's longer than I've been around, and I've been there for 10 years.
Okay, so fair enough. So talk to us a little bit about the Adolescent Health Program and how that works at your centers, what you guys do. I don't know who wants to answer that question.
Well, I can give some background on the program itself,
yeah.
And then Dr. Daniels, if you'll fill in with what you do at your center. We are very fortunate and appreciative to Children's Services Council of St. Lucie County. As you mentioned, we've been funded for a number of years for our Adolescent Health Program. And in a nutshell, our program is to help teens work through the teen years. Now, my teen years are long behind me, and I did not have to deal with any of the issues that teens today do. Our program is designed to help reduce and prevent teen pregnancy and other high-risk behaviors such as sexually transmitted diseases, unprotected sex, smoking, drinking, bullying. You know, now we're getting to this whole virtual world, and there's a lot of online bullying going on, and we've been seeing, you know, horrific news stories probably within the past 2 or 3 years. So we're very fortunate to have doctors like Dr. Daniels who treat children and teens and adolescents down at our Port St. Lucie Children's Health Center in Port St. Lucie. And when they meet with them, they talk to them about these issues. Sometimes it's easier for kids to talk to somebody else they're not automatically connected to, such as a parent or maybe a sibling. That's why physicians and other medical providers and guidance counselors are so successful in talking to kids about some of those issues, because they're tough issues to talk about. As I said, I'm well past my teens, and I still wouldn't talk to my mother about those issues.
You have a teenager.
Yeah, I have 2 teenagers.
Yeah.
So I can relate, especially the technology issue. I mean, you know, if I want to talk to my daughter, I don't talk to her, I text her, right?
Exactly.
But I'm curious, Dr. Daniels, because, you know, what, particularly, you know, when we talk about Florida Community Health Centers and the doctors and the medical, my mind doesn't go towards automatically what you said, which is talking to teens about, you know, cyberbullying and healthy decisions. So how do you, when you work with teens, how do you make that transition? You know, you're checking them out physically, and you're like, oh, by the way, do you have a cell phone?
Well, you know, they all have cell phones. So
Silly
that's
question.
the easy part. But seriously, you know, and that's one thing I wanted to reiterate. You know, everybody thinks about the babies or the toddlers, bringing them in for their checkups. But our big kids, we want them to be coming for their yearly physicals. And that's the time where we, you know, even if they're well, they don't have any chronic health issues, we check them from head to toe, make sure there's not anything there that they or the parent had noticed. And then, you know, there's a time for us to kick the parents out of the room and have those type of conversations with them, ask them about drugs, alcohol, sexual activity, you know, certainly counsel them as to, you know, what we feel is in their best interest. And other things that come up, you know, are kind of subtle. You know, a mom may say that their child, I don't know why he won't sleep. He's up to 2 o'clock in the morning. He's not getting a good night's rest. And then as you dig deeper, you uncover some of those things, whether it's bullying or a change in the family dynamic. And so just really asking those questions, with the teens. But if they don't come, we can't ask. So we, our big kids, we still want to be seen even if they're not ill, because they'll bring them in when they're sick, but we really want to see them for their physicals as well.
That's it's such an interesting point that you make, and I think that a lot of times I am also well removed from my teenage years, but I think a lot of times in talking with kids, we've done research that says that kids do want to have those conversations with their parents, but it's not easy to start there. And oftentimes having a doctor or a guidance counselor or someone to look to who they see as an authority figure kind of helps to start that conversation, because they're looking to you as a respected individual, as a respected doctor, and it's easier to start that conversation than going to mom and saying, this happened or something like that.
And there are times where a patient may, tell me something, and I'll say, okay, well, you're telling me this in confidence, but would you like your mom to know? Do you want to bring your mom back in and let's the three of us talk about it? If they say no, then we would kind of zip our lips on it. But I really encourage them, and a lot of times when that third party is there, when I'm there, it's easier for that conversation to get started with the parent, because like you said, they, and in some cases I encourage them to say, your parents need to know this. Let's bring mom in, let's bring dad in and start that conversation.
I'm curious, Dr. Daniels, do you find that when the three-person conversation happens, that the parent might be a little bit relieved as well because there's somebody there to mediate?
Yes. And a lot of times the parents may even have an inkling that something is going on, but they don't know, and they don't know how to approach their child either, because there's a fine line there. So a lot of times having that third person really does help.
And I don't have children, but I would imagine as a parent, it would be very difficult to start those conversations. So that's the entry into that conversation. I don't know if I'd want to be in the car on the ride home,
Right.
but it's a great way to get those conversations started.
And sometimes, and you're right, we mentioned I have teenagers, and I always have that conversation when they're in the car with me, because I can't go anywhere, right? But it is terribly uncomfortable for that child, and sometimes the parent, depending on what the responses are. So I want to mention about access to your services.
Yes.
Because, while our listeners and viewers are watching it and thinking, because, you brought up a good point, when we think about medical health for children, we always think of, 0 to 1, 2, 3, 4, 5, but it's just as important as for teenagers to check on their health. But how can they access the services? When they get to your place, what's the typical steps they have to go through?
Well, let me throw out our website
Yes.
first, which is www.fchcinc.org. And all of our centers are listed on there with all of their phone numbers, biographies of our clinicians, so they can look around and see, sometimes you see a connection, maybe a college or something, and you say, oh, that's who I'd like to go to. We have 11 health centers that surround Lake Okeechobee and throughout the Treasure Coast.
Wow.
And as I've mentioned to you before, we're opening up our 12th center, which will be in St. Lucie County in November. We provide, in St. Lucie County specifically, we have 4 centers today. 5th will be November. I could rattle off the phone numbers, but I think that would be confusing. Go to the website, go to our Facebook page. As I said, all the numbers are there. And we accept most major insurances. We do accept Kid Care. We do accept Healthy Kids. We do accept Medicaid. We also are in a position, we are designated as a federally qualified health center. And that tells the community as a whole that we are designated where we see anybody and everybody, regardless of their social or economic status. I will put this out there. Some people like it, some people don't. We don't care if you're a resident of this country. As a federally qualified health center, the law is that we have to treat everyone. We have to make our services available to everyone. If someone does not have health insurance, they can come in, and we have what we call health benefit coordinators. And we work with Danny very, very often to help people walk through that eligibility application. If you've ever seen these applications, you almost have to have a PhD just to get through them. They're very confusing. Again, I'm glad I don't have kids on that one. But if somebody is not eligible for a program, they can come into us, and we provide services on a sliding fee scale. And it's dependent on the income of the household. Some people come into us and they pay a $20 copayment for all of our services. That could be the office visit, in laboratory work, in some of our centers, x-rays, dental, so on and so forth. And again, that slides. We have a 6-tiered sliding fee scale, depending on where people fall within that economic household range. So we're very excited, about our 5th center opening up in St. Lucie County. And as I mentioned, Dr. Daniels will be moving from Port St. Lucie Pediatrics over to the Darwin Square Center as the clinical coordinator over there. So, and we've hired our center manager, Stephanie Beach. She has already joined our organization, and she's been going through all kinds of training and meetings and getting out into the community to really meet the movers and shakers. So we're very excited. St. Lucie continues to grow, and we want to grow with it.
And that's actually that area where you guys will be going, the Darwin Square area,
Yep.
is a huge growth
Yes, it is.
location. So
Yep.
what a great opportunity for that community to have access. Now, you mentioned that right now you're currently at the St. Lucie,
Port St. Lucie Children's
Port St.
Health
Lucie
Center.
Children's Health Center. So what kind of services? We talked about some of the big kids, but you guys see little guys too.
Yes, so we see, 0 to 18-ish. We do have some 19-year-olds, 20-year-olds. My partner, Dr. Shield, is hanging on to some that are even older than that. But we, at least get them out of high school. So we have some patients that are 18, 19, they're still in high school. We see them through that period. We do go to St. Lucie Medical Center and see newborns in the nursery. So a lot of our babies will see there right after birth, and then they'll continue to come to our office. So yeah, we see from, from 0 all the way up.
Now, when we were talking about at the beginning about healthy kids and how important it is to establish a medical home, I didn't quite articulate it like that, but that's what I meant. Can you maybe, for our listeners and viewers, talk about how important it is to regularly see a doctor with your child from birth to 18-ish?
Yes. It's so very important. I can't, it's hard for me to just kind of sum up how important it is to have someone who knows you, who knows your family, to get a phone call from a parent and you're like, oh yeah, I know that they just, moved, or that they just, this and that happens. To have someone that really knows your family, it makes it more pleasant for the kids, especially as they get into those teenage years. They may be more comfortable opening up to someone that they've been seeing for a few years as to someone they're just meeting for the first day right out the bat. And then the parents develop that trust in you that, that you have their children's best interest at heart. Is vitally important to have someone that you can go to with those concerns.
And here in St. Lucie County, we are really positioned where we can treat the entire family for their entire lifespan. As Dr. Daniels mentioned, we see the babies in the nursery. Well, we have 2 OBGYN practices in St. Lucie County, one in Fort Pierce and one in Port St. Lucie. So as a mom is transitioning through her pregnancy with one of our clinicians or at one of our centers, they can go right into our pediatric practices and be seen there for their entire lives. Our Fort Pierce Center down in Delaware, we treat everybody every age. So I usually say from cradle to college and beyond. So it's the entire lifespan.
Well, and I mean, really, you don't get that opportunity at a private doctor's office. I mean, if you would never get that
Not usually.
opportunity there.
No.
So that's really a unique kind of asset that you guys have, and how wonderful that we've got that here in our community.
And now,
But there's more.
it began last Monday at our Fort Pierce Center, we have an in-house pharmacy.
Oh, wow.
Right.
Oh, wow.
So any of our patients from any of our centers can go to our in-house pharmacy in Fort Pierce. It's at 1505 Delaware. It's across the street from McDonald's.
I know that well.
Exactly. And get their prescriptions filled by any of the prescriptions that are filled by any of our clinicians. Now, we're in a position where we can offer deeply discounted pharmaceuticals and medications because we're a federally qualified health center and some of the programs we belong to. Just like at some of the stores, you can get your $4 antibiotics. So imagine you've got your kids, you've taken your kids to the doctor, they've all got earaches, which school has just started,
It
so
will
who
happen.
knows what they're
Yes.
going to come home with. So you get to see the pediatrician, and instead of the pediatrician just writing you a prescription saying, hey, go to the pharmacy, they can get that prescription filled right there
Wow.
before they even leave.
That's
It
great.
really is one-stop shopping. And now that we're in summer when it's pouring rain at 3 o'clock every afternoon,
Every afternoon.
to not have to get in and out of the car, it's just a great asset that we can offer to the community.
That's wonderful.
So we're very, very excited about it. It started last week, and over last week, they filled over the week over 150 prescriptions
Oh, wow.
in their first week.
That's
Man.
awesome. We often talk about the barrier sometimes for getting help is cost and transportation.
Absolutely.
So you're addressing the cost issue, and then you're addressing the transportation, because if they can get there, they pretty much, it's full service.
It is, and there's a bus stop right
Right
in front of
outside, I
our
was
Fort Pierce
gonna
building,
say.
and right by the
Right
St.
across the
Lucie.
street, yeah.
Exactly.
That's
Oh,
outstanding.
wow.
So we've got a couple minutes left, and I just want to
I
throw
told
this.
you I had lots to talk about.
I just want to throw this question out there just for a minute or so. So, is there any tips? Because we've got parents taking their kids back to school now. We've got kids that are going through high school, getting ready to go to college, birth to college, as you said. Is there any tips that parents and/or teens should have in regards to taking care of themselves?
Get your, go to the doctor, get your yearly physical like we talked about. And then there's also, vaccinations, again, you think about as the babies, but there are some available for our teens that they should really avail themselves to. One is the Tdap, which is pretty easy because it's required for the school, but that's their tetanus and pertussis booster, their meningococcal or their meningitis shot. A lot of the colleges require that, especially if they're going to be in the dorm, and that's an illness that can make them so sick so quickly. If there's anything we can do to prevent that. They get one dose at age 11 and a second at age 16, and a lot of the college forms that they bring to fill out are wanting to know that they had that vaccine. And then also the HPV, the Gardasil vaccine, which protects against the virus that causes cervical cancer. For our girls and even for our boys, it prevents penile cancer. And talking to moms, I've had so many moms say to me, if I can prevent my daughter from going through what I went through, as an adult, if they had an abnormal exam, or even some of our moms who have had cervical cancer and have to have hysterectomy and those things, they say I would do anything to keep my child from going through that. And we have something that helps protect the girls from that. And I would say avail themselves to those things to help, protect them now and into the future.
So we're fortunate in St. Lucie County. You have 5 locations in our community to service the whole family. Particularly, we're focusing on the children, birth to college. I like that. Real quick, we've got about 10 seconds. What's the website?
www.fchcinc.org.
Thank you so much, both of you, for coming on the show.
Thank you.
This only works, folks, and thank you.
For showing up.
This only works, folks, if you get involved and share the information. It's a weekly radio program, a monthly television show. We're going to end like we always do. I want to remind everybody, it's our children, our community, our future. We're all in this together. We'll see you next time.
Great.